Salt is often called the heart of every dish. But for patients with hypertension, it's also the heart of many concerns. How much is too much? We all need to know. Let's turn to an expert for clarity regarding ideal salt intake for managing hypertension.
Thanks, Ronit, for this good question. How much salt should a person with BP consume per day? Ideally, person should consume only 5 gram of salt daily. That means in 24 hours to control BP, because salt will absorb more water. It will increase BP. And the food which contains salts like cheese, processed food, pickles, some dishes which contain high dose of salt, seafoods with high salt as a preservative, they should be avoided because salt will increase BP. And if patient take medicine but he is taking so much salt, the BP is not under control. Hence, we advise low salt diet, and again, I advise them to use minimum salt once the food is processed. We can sprinkle salt from above and use lemon as a test instead of salt. Thanks.
Thank you, doctor. Your expert advice will empower patients to strike the right balance, savor their meals, and successfully get to goal for healthier blood pressure. One of my relatives has high blood pressure, but tracks it diligently twice a day, keeping a record to stay in control. While some friends tease him, it raises the key question: how crucial is regular BP monitoring, and what's the best way to do it at home? Doctor, please, could you share your expert insights?
Yes, home-based BP monitoring is very crucial because hypertension is a silent killer. You should monitor your BP at home with standard machine. Prior to BP checkup, you should not consume any tobacco, any tea. You should not walk upstairs. You should not do exercise. You should be seated comfortably in the chair with the BP cuff at level of your heart, and the sphygmomanometer, which is having mercury, should be used, and it should be checked by some nurse assistant, or if electronic machines, you should take 3 readings, mostly early in the morning at 9 a.m., at 10 a.m., and you should twice a day check BP regularly and keep a note of it. It will help your doctor to prescribe right medicine on right time. Yes, thanks.
Thank you, doctor, for clarifying this important topic. Your guidance inspires patients to take control and confidently get to goal with their blood pressure targets. Exercise is often called the best medicine, but is it the same for hypertensive patients too? If yes, which type of exercises are recommended and which are to be avoided? It's so confusing. Let's ask our experts for insights on the role of exercise in managing high blood pressure and whether there are specific types or durations of exercise recommended for better control.
Exercise is important in managing blood pressure. It will strengthen the heart, it will improve blood vessel function, it helps to manage weight, it increases insulin sensitivity. So which exercises? Either you should do 150-minute per week moderate intensity exercise, or 75-minute per week vigorous exercise. It may be aerobic exercises, aerobic like brisk walking, jogging, dancing, cycling, swimming, or you can do resistance exercise like weightlifting. They will maintain your body weight, they will manage BMI, they will reduce BP, and they also increase insulin sensitivity. So for healthy life, according to doctors, along with medicines, exercise plays important role. Yes, thanks.
Thank you, doctor, for highlighting the critical role of exercise in managing hypertension. Your advice will help patients incorporate the right physical activities into their routines and stay on track to get to goal with their blood pressure targets.